At Hornsey School in East Yorkshire, pupils aged between 12 and 15 have already made the choice whether to get vaccinated. Of around 800 who could have had the jab last week, just over half did. The school made a decision beforehand not to ask pupils and parents why they'd made their choice.
Anecdotally, there were some students who would perhaps have COVID quite recently and so wouldn't be in that window to have the vaccination. There were some who were off and unwell that couldn't have it, and then I imagine there will well have been some of those that chose not to have it for whatever reason that might be. But as I said, we tried not to pry really into those decisions. We just acted purely as facilitators for that.
In England, only 15% of 12 to 15-year-olds have had a COVID vaccination. In Lincolnshire, they're well ahead of that, with more than a quarter of children jabbed. But north of the Humber, the figures are low. In East Yorkshire, it's just over 9%, and in Hull, fewer than 7% of 12 to 15-year-olds have been jabbed. The government promised to offer all 12 to 15-year-olds a jab before half-term. The parts of the NHS organising the school vaccinations here say all pupils will be given a consent form before the holidays, and that vaccinations should be complete by the end of November. But among medical experts, there are concerns misinformation on social media could be influencing children's decisions.
Turn to somebody who's spent years and years of training for that role, and maybe 30 years of their life giving that kind of advice to patients. So turn to a health professional, turn to a doctor or a nurse or a pharmacist. Go to the right sources. Don't trust Instagram.
There you are. 12 to 15-year-olds are given one shot of the Pfizer jab. Until now, that's had to be given in school. But from half-term, the government says young people will be able to book an appointment at a vaccination centre, an effort to get more pupils getting the jab more quickly. Anne-Marie Tasker, BBC Look North, Hornsey.